Can I invite now Minister Gentleman to the podium to say a few words?
Well, ladies and gentlemen, it's a great pleasure to be with you here this morning. And firstly, can I thank Richard for that fantastic welcome to country. A really, I think, moving story and something we all need to take to heart. Can I also acknowledge the traditional custodians of the land we're meeting on, the Ngunnawal people, and I respect their continuing culture and the unique contribution they make to life in this area. To Minister Joy Birch, welcome here this morning. Fantastic to see your work rolling out here. And my Assembly colleague, Mary Porter. Mary Porter and I have shared quite a bit of work together in regard to restorative justice for young people in the past. To Natalie Howson, Director General of Community Services Directorate. To Kerry Heath, Principal of Dixon College. And Dixon College is, of course, Andrew Barr's old college, so great to be here on his stomping ground. To Professor Louise Newman and other experts in the field, and of course welcome guests. It's with great pleasure that I welcome you here today to the official opening of the Trauma Recovery Centre, or Melaleuca Place, a therapeutic service for ACT children and young people who have experienced trauma as a result of abuse and neglect. Melaleuca Place is a targeted, multidisciplinary, holistic early intervention and prevention service committed to supporting children and young people to heal from trauma. It also repairs existing relationships and establishes new supportive and protective networks. The ACT Government committed $3 million from the 2013-14 budget over 4 years to establish the service as part of a commitment to protecting children from abuse and neglect. Childhood trauma is one of the nation's most important health concerns, with adverse childhood experiences being one of the strongest predictors for difficulties in life, including physical and mental health problems, also social and relationship problems, and poor educational and vocational outcomes. We've read through the media recent leaked testimony of victims at the Australian Royal Commission into Institutional Response to Sexual Abuse and celebrity prosecutions of the devastating lasting impact of child abuse on individuals. This service, Melaleuca Place, is a tangible response to intervening early to repair damage and to give children the best chance no matter what may have happened to them. We know from current research that many children involved in the child protection system are exposed to a number of situations early in life that increase their risk of experiencing not only trauma and disrupted attachments, but also developing mental health problems. By the time a child has entered the care system, they may have already been exposed to multiple traumatic experiences, including abuse, neglect, exposure to domestic violence, a family history of mental health, drug and alcohol abuse. We therefore know that children in care display consistently higher rates of behavioural and other mental health problems, as well as compromised cognitive and adaptive functioning than children in the general population. The ability of a child in care to make sense of these traumatic experiences and develop meaningful relationships or attachments that may assist them to overcome the trauma is hindered by their separation from family, culture, community, peers, and frequently school environments. We also know that the brain is altered following prolonged exposure to trauma or stress. And this can include permanent changes in brain structure and function. These developments have coincided with the emergence of new theoretical frameworks that focus on trauma-informed therapeutic approaches to working with children, and in particular, focus on a child's development age and the importance of building safe and secure relationships as a means of recovery. As a community, we need to endeavour to prevent child abuse and neglect before it occurs. The Child and Family Centres in the ACT and other universal primary prevention and early intervention services focus on this goal, in close partnership with our community partners and health colleagues. However, where abuse and neglect has occurred, there's growing evidence that intensive intervention as early as possible in the life of the child and in the development of the problem can help to temper the detrimental effects of abuse and neglect. In essence, there is need for early intervention in the tertiary system. That is, the prevention of further traumatic and harmful situations for the child who has already come to the attention of statutory authorities. Melaleuca Place will provide a high-quality, trauma-informed therapeutic services to children. In particular, Melaleuca Place will facilitate healing, recovery and positive life outcomes for children and young people recovering from abuse and neglect. It'll provide evidence-informed intensive therapeutic services and lead a trauma-informed, collaborative and flexible approach that assists other service providers and those who support the child in their family setting. Melaleuca Place will work with established organisations such as the Child and Family Centres, the Child at Risk Health Unit, the Child and Adolescent Mental Health Service, Barnardo's, Marymead and the relevant community partners to give these children a chance to develop into happy and healthy adults. Not only does it take a village to raise a child, it takes a supporting and informed village. And Melaleuca Place will be the hub for this therapeutic village. Now, ladies and gentlemen, just before I conclude, can I congratulate again Minister Joy Birch on her hard work on the program to institute Melaleuca Place, and can I congratulate also their directorate, the staff and their passion for ensuring that in all instances it's the child that comes first. I'm really looking forward to working with them and their passion over these 4 years. And in closing, can I warmly welcome you all here today, and I trust that you enjoy the opening as well as the symposium to follow. Thank you.